I want to start this by stating that this message comes out of complete respect. But first and foremost, I'm speaking to the Prime Minister of Canada, Mr. Justin Trudeau, but I'm also speaking to all provincial leaders in Canada. But this message also applies to governments from around the world and when it comes to healthcare systems. Because Mr. Trudeau recently made a statement that our healthcare system is broken. And I'm going to sit here and tell you that it is not our healthcare system that is broken. It is the lifestyle that is broken. And if we were to pay attention to the data and science that we, the people, pay for, we would know that the majority of all preoccupied beds and the majority of all chronic illnesses comes from consumption. It's self-induced. It's self-induced. And they say that statistically less than 3% of the population lives this lifestyle, a metabolically healthy lifestyle. I used to be that guy, right? And I know today through education, due to the education that I educated myself on, we have the best in medical professionals. And I'm speaking to medical professionals. What if you could truly pay attention and deal with your misfortune and those that are they're dealt a bad hand in life, they have the bad genes, which accounts for less than 20%. 80% of the people you're dealing with are those self-induced, all due to consumption. And that's our problem. It is our lifestyle that are the issue. If I was to tell any business leader that I could increase your profitability by 7% or decrease your losses by 7%, they would do backflips while listening to understand. So when they say that less than 3% of the population lives this lifestyle, and if we had the education from the onset, from the ground up, and we can teach the population to live a healthier lifestyle, to live medication-free and disease-free, could you imagine if 10% of the population was living like that? Our world would change healthcare-wise. We would have more time for the medical professional to deal with the misfortunate and those that are predisposed. And the reason why I'm sitting down today is that the majority of the people over 50 wouldn't be able to get up from it. They get up, but you swear they got hit by a car and they're trying to get up, right? And it's because they're so full of consumption that is destroying their knees, their joints, their health. They're filled with visceral fats, some of the most dangerous fats out there, right? So I'm speaking from knowledge here. From knowledge that I educated myself on, and I'm telling you it's an operator error issue. It's all due to consumption, and the reason why it's an operator error issue, because the general population never got the orientation, they never got the training, they have no clue what autophagy is, and the majority, even though you tell them that this is unhealthy and that's unhealthy, you've never taught them why it's unhealthy. You never taught them how to take care of their engines from the ground up. If you were to take a minute amount of money that is spent on medication advertising and vaccine advertising and put that to true health advertising, you would, I don't care if you bring it up to 5% or 10%, and if you can bring it up to 20%, bravo. Let's start educating on metabolically healthy lifestyles. Jean-Guy Bourguignon, Jean-Guy Public Communication.